Hello, Prump. I'm Dr. Michael Reiner, your host of the Independent Doctors of Prump, and I'm back from a couple of weeks of traveling and having to be out of the office and be out of town, not being able to make the show. And tonight I find myself covering for Dr. Christensen, who's going to be late here. He's been grateful enough to cover when I'm out of town, so the show will continue. And I understand that he had a guest on last time and had a lot of questions, so I think that is wonderful. So as you know, the call-in line will be 727-8750, and as usual, feel free to call in with any of your questions, comments, or concern. And so what's in the news is obviously talking around health. We have Hillary Clinton getting sick with pneumonia and having that problem. So I'm sure that will raise some concerns about pneumonia and related issues with her. Who knows whether or not it really is the truth or not the truth. So help you God, we know she's a liar, and once you're a liar, you're always a liar. So, but before in between, we're going to be taking a call here from a minute from Ray, and when we do that, we're going to talk a little bit more about pneumonia and things like that. Ray, good evening.
Good evening. Yeah, Ray the Flagman. And what was the first thing you were talking about? Because I had it on mute. What were you just talking about?
Well, I was going to bring up the fact of something in the news, Hillary Clinton and her pneumonia, and that it's probably a lie also, but that's neither here nor there. We can talk about pneumonia prevention, and getting ready for flu season, something along that line, since that's right around the corner.
Well, I didn't want to interrupt that one, Doc. That one's going to be interesting, but I'll be listening.
Yeah.
People have told me, I meet people at the courthouse every day. I'm there, and people got all kinds of respiratory problems. They don't know if it's bronchitis, if it's a flu or what, but, it's amazing. Summer colds, they're calling it. And I don't know if that's true or not. You see quite a bit of that in your office now, people with having trouble breathing?
Well, I had a summertime cold about, I want to say about a month ago, and it lingered for a week and a half. And one of the things that came up was, and keeps coming up, is as we get older, as adults, we have a tendency to, our immune system kind of waxes and wanes. And so a couple of years ago, there started to be a recurrence of some adult pertussis, and maybe even a slight, those types of things. And we had that pertussis outbreak, I think, in California and things of that nature. So one of the things you can do is think about getting a DPT, an adult version, to help strengthen that immunity. And because you may not know it, but you got immunized as a child to it, and so it tends to, if you were to get something similar, it may take you a long time to build up that immunity. Whooping cough is a problem in pediatrics in the sense that the cough is dependent upon the small size of their airway. In adults, we don't have that problem, but it can be just as difficult to get rid of it, and that's one of the things that could be a problem. So I wanted people to think about getting re-immunized if they haven't, not just tetanus, but you don't want to get the DATP, which is the acellular form, but you might want to get the DPT if they make that for adults. And I was going to do some research on that, but never got around to doing it. So.
Well, about 5 months ago, I had a cough. I couldn't believe it wouldn't go away. I saw you prescribed the antibiotic. And it started going away, and it's coming back, and then I called you, and the second dose did it. It knocked it out, and I was so happy because I thought I was going to die.
Yeah.
I was coughing and hacking, and I said, what the hell is this?
Mm-hmm.
I'm usually pretty healthy, and that's what bothered me. All of a sudden, out of the blue, I don't know if I got it at the courthouse or what happened. But I was so grateful. I says, geez, the doc comes through. I was antibiotic and prayers also. But
and you wear gloves, so you run. The fact that you do wear gloves is a good idea, because that you're touching the doors and handles and things of that nature, and that's one of the way the cold at least is spread. Not to mention someone coughing and aerating the thing. So one of the masks. If you wear a mask, it's not necessarily going to prevent you from getting sick, but it definitely will help prevent the spread. So if you feel like you're going to get sick or you're getting sick, it's a good idea if you get that scratchy throat to think about wearing a mask, and then you can help prevent someone else from getting sick. And that goes a long way because you're not aerosolizing the virus. So pick up those N95, N as in Nancy 95 masks. Those are the ones that you can buy even at Home Depot. Those are the ones that really will protect a lot of the small particulate matter that you can cough and sneeze. And then practice good hand washing and try not to do one of these things where you actually touch your face, because that's how you can spread some of the viruses that you pick up. It's not necessarily you inhale them, but you put them on your face and then they can get in there from there. So,
you know, you're right about me wearing the gloves, and I wear them year-round. You know, people think I'm peculiar. I carry a big pillow in the courthouse because the benches are like icicles, and so I sit on a pillow. Now, if I start wearing a mask, they're really going to say the flag man is whacked out completely. I'll say it's doctor's orders. He told me to wear this.
No, if everybody walked around wearing gloves, they'd think we're all suffering from Howard Hughes syndrome. But I mean, the fact that you do would probably eliminate some of those things.
Well,
so,
I found out it does help because I shake hands, you know, and I don't really apologize for the gloves. People see me with it, and if they want to shake my hand, they see I'm wearing the gloves.
Well,
And I've been doing that for years, for probably 19 years now.
Yeah.
So it's unusual, but it's part of the flagman's persona.
it's part of your calling card, Ray. That's what it is.
That's right. The question for tonight, and I asked it about 6 months ago, but I'm a little concerned again. When I bump myself or bruise, the bruise is, you know, comes up pretty quick. It's sometimes a little bleeding. And my ma had that, and I was wondering if that's hereditary, and is that a vitamin deficiency? Is there some vitamin I should actually, you know, like capitalize on to help me out on it? Because I won't even notice it. You know, I'll bump myself and I'll see my arm is bleeding or something. I'll say, geez, it was just a little tap. So if you can explain that, and I'll probably call later in the show, but I also want to hear about Clinton. That's very important. I'm glad you're going to bring that up.
Yeah, so yes, and what you're suffering from is an entity called senile purpura, and again, that sounds really bad, but it's P-U-P-R-A, but purpura is a term of defining a skin or a blood area under the skin, and if it blanches, it's non-blanching. But really, what happens is we get older, our capillaries, our skin loses its elasticity, and our skin becomes thin. So the capillaries in our skin break. And so you really don't have the cushion, so you just rub up against something, and the next thing you know, you've got this little bloody area underneath your skin. So it's unfortunately an aging related issue. If you're on blood thinners for any reason, it's going to be 10 times worse, and you don't even have to, you just have to rub your hand across your arm, and you may bleed depending on your how much blood thinners you have going on. There really isn't anything you can do. The more clothing you wear, it may benefit a little bit, but it's just a function of being a little bit older and having that entity. So if you're using cortisone creams or anything like that thin your skin, it's going to be worse, because that's what the side effect of cortisone creams are. They cause thinning of your skin because they narrow the blood supply. So those are things you can avoid with that. Obviously, if you have heart disease, you need to take your aspirin or your blood thinners, and that's just something you have to deal with. So it's not an hereditary thing, and there's no blood test to figure out what you can do about it. You can try and be as careful as you can, but I mean, just rubbing your arm against a table or doing something will cause it to bleed a little bit like that. So hope that answers your question. I encourage people to, again, think about getting a flu vaccine as they're coming up, as long as you're under the age of 70. I think when you get over that, there's really some question whether or not it helps. And then I would really encourage the Prevnar 13 vaccine. If you haven't had one, you need one after age 65, and then you come back 6 months later to a year and get the polysaccharide 23 valent. So even though the numbers are different, the polysaccharide 23 doesn't seem to be as efficient as the Prevnar 13. And if you get polysaccharide 23, you have to wait a year to get the Prevnar 13. There's some thing where it may block some of that immunity. So there is an order of preference in getting which vaccine you get for the pneumonia. And even though I despise what the pharmacies are doing to some of the patients around here, it probably is one of the better places to get those vaccines. And obviously, any type of cold or flu, if you're a smoker, if you're a diabetic, if you have any other cardiac condition, you're more likely to get a pneumonia than you are if you're not. So it's very important for those people to think about that. The flu vaccines will probably be out here in the next couple of weeks. This is about the year, about the time that, that we think about getting those. I haven't seen a lot of colds or flus hitting yet, but there has been that limited summertime cold. And I almost have a theory that we actually have the cold virus in our body all the time, and that our immune system gets low when we get sick, but I can't prove that. So we're going to go to break, and then we're going to come back, and I'm going to be joined by my partner, Dr. Christensen, and we'll be right back. Thanks for tuning in. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.